Marc Yale, the Global Skin Board President, former Executive Director of the International Pemphigus and Pemphigoid Foundation, and a rare disease skin patient. Well, I have to say the significance is immense. When people come together globally, we are much stronger, and we're able to share our diverse experiences. We're able to create new discoveries and challenges to those potential problems, and create solutions that allow us to better serve our patients and our communities around the globe. So, when we collaborate together, really the entire dermatology community, including dermatologists, dermatology nurses, patient organizations, researchers, and even industry, we're better able to address the impacts that these diseases have on patients, and really be able to elevate and prioritize health policy at a global level. Yeah, so the Global Dermatology Coalition that has been created is really, it's a patient-led, multi-stakeholder group of like-minded organizations, including, again, dermatology patients, organizations, healthcare professionals, and researchers in industry. And the coalition is designed to advocate to the World Health Organization and other decision makers around the globe to elevate healthcare and prioritize dermatological diseases. So this multi-stakeholder group is focused on improving patient outcomes globally, raising awareness of the burdens of skin diseases, and it's a multifaceted coalition that impacts all of these skin diseases. And the collaboration, is really needed because, the reality is it's very difficult for patients that are facing skin diseases. And together, these organizations that are in this coalition are really actively working to improve the outcomes of these patients globally. And this means improving access to things like diagnosis or delay in diagnosis, care and treatments, and also to be able to provide the support that skin patients need, when they need it, no matter where they live in the world. And that's very exciting. So the coalition really speaks as one voice, because people living with dermatological diseases, their caregivers and their families really deserve to live without the stigma that they have from these diseases, and they deserve not to be minimized, and to really be able to achieve a higher quality of life. Many areas of healthcare, dermatology was really caught off guard by the fast-spreading and dangerous virus that triggered a range of challenges for patients seeking treatments while facing social distancing laws that spiked the anxiety levels, leading to lots of inflammatory reactions, which in turn, worsened existing or new skin conditions. It's kind of been a challenge and a vicious cycle. But we need to be much more prepared for the next pandemic and be prepared for the future. And I think that our patient organization members, in Global Skin, definitely you need to have the ability to have that social dialogue. Whether it's through social media or just being able to communicate and talk about those things, I think is very important. I think, face-to-face interaction, I think, is still preferable. I mean, patients really need to be able to develop those relationships. with the doctor and really to be able to stimulate that doctor-patient relationship. But in many situations, teledermatology, I think, helps to augment care. And it can also help build connection between the doctors and the patients. I mean, there's, many barriers to access when it comes to patients being able to see a doctor and being able to develop that relationship. So teledermatology is definitely, there are certainly some advantages to that. And I think that, the one bright spot I would say about teledermatology is that it really, especially during the pandemic, obviously, it provided more opportunity for continuity of care in a crisis situation, and also it probably accelerated access to specialists, and made things a little bit more efficient. So, with dermatology, we're obviously a lot of times talking about very complex diseases, and so that face-to-face interaction sometimes is important. But I think there is a place for teledermatology, and I think it just, we need to make sure that we manage our expectations and we utilize it where it is necessary and where it can be most effective. Well, thanks for the opportunity to talk today and discuss the multi-stakeholder approach to dermatology. And I look forward to seeing everybody in Singapore next year in 2023. See you soon.